So good afternoon, everyone. Thank you for inviting me to present in this symposium. The study was investigating the hepatic and metabolic impact of a 3-week hypocaloric diet in overweight and obese individuals. To start off, very briefly establish, and we all know that prior to bariatric surgery, the implementation of low caloric diets is routinely used to reduce intra and post operative complications, especially in the reduction of liver size. It's been shown by observational studies that a low energy, low carbohydrate diet leads to liver shrinkage. However, there is controversial and limited evidence on the effect of low caloric with restrictive macronutrient composition on liver function, specifically impact on key clinical liver enzymes. So, in just 3 weeks, what are the hepatic benefits of a macronutrient restricted low caloric diet on overweight and obese cohort? So the aim of this study is therefore to assess the efficacy of a 3-week hypocaloric diet on metabolism and also, more importantly, examine the effect on hepatic functioning in this cohort.
Yes. Okay. So in the study that I'm presenting my poster, which is hanging over there, we did a multi-transcriptomic analysis where we looked at the gene expression in a mouse model of diabetic kidney disease. And we included 3 groups in this study. The first one was the DBM group, and that's a healthy control group. These are normoglycemic mice that have both of their kidneys. Then we have the second group, that's a type 2 diabetic group, and these mice have had 1 kidney removed. And then we have the last group, which is also type 2 diabetic mice that have had 1 kidney removed. And then on top of that, these mice have been injected with a viral vector encoding renin to induce hypertension. And that was also the model that Mette presented earlier today. So at termination, we took out kidney samples for RNA sequencing of the kidney cortex. We also took out a sample for isolation of glomeruli, and then we performed RNA sequencing on them. And then we also did single nucleus RNA sequencing of the kidney cortex. And then we combined the data from these 3 analyses, and the results that we found you can see on my poster.
Thank you very much. And next one is Frida Emanuelsen.
Thank you. Hi, I'm Frida Emanuelsen, and I work at the Department of Clinical Biochemistry at Rigshospitalet in Copenhagen. And today we've heard a lot about the association between obesity and chronic kidney disease. So I brought some data today from a general population setting where I look both at observational data and genetics to try to disentangle the association between obesity and chronic kidney disease, if this is an effect of obesity as such, or if it's an effect mediated by metabolic changes related to obesity. So my poster is down by the door there. Thanks.
And the next one is Mads Thomsen.
Thank you. So, my name is Mads Thomsen, and dietary recommendations in the management of patients with type 2 diabetes and obesity focus on weight loss, but no ideal macronutrient distribution is recommended to these patients. In this study, we aim to evaluate whether a carbohydrate-reduced high-protein diet, when compared with a conventional diabetes diet, improves glycemic control and liver fat content beyond the positive effect of weight loss. To investigate this, we provided all the meals to the participants for 6 weeks free of charge and adjusted the energy content twice weekly to match the weight loss between the 2 groups. And the results on HbA1c and continuous glucose monitoring and hepatic fat fraction can be seen later at the poster number 4. Thank you.
Thank you. And the next one is Mark Lyngbeck.
Thank you. Like Jens and Sten already alluded to, remission in type 2 diabetes is a possibility, but how it is possible without surgery is still not clear. So in an attempt to answer this question, we have randomized 82 persons with type 2 diabetes into 4 groups, 1 control group, and then 3 intervention groups. We will assess beta cell function using gold standard before and after the intervention. These results will add to our understanding of the dose response effect in combination with a diet-induced weight loss on beta cell function. Furthermore, investigating what mediates these effects may open avenues for future therapeutic targets. And I will be happy to answer your question and discuss about my poster. Thank you.
And the last one, Nikita Misela Hansen.
Okay. Hi, my name is Nikita. I'm from Rigshospitalet, Department of Nephrology. My poster is here in number 6, where we would like to discuss why nutrition is important among patients with CKD. This is a post-hoc analysis from a short-term study conducted by my supervisor, Louisa Salomo. The study here looks upon acid-base metabolism and uremic toxins. It is a crossover randomized control study where we basically looked at the importance of nutrition for 1 week. So what the results are very interesting, and due to the fact that these results are very positive, we are now conducting a long-term study where I am basically looking at the effects over a period of 6 months. I'm not going to go into details with 1 minute, so you can see the results over here. Yeah.